All right, we have a good bit of information to put out today, a lot of numbers, but prior, Mayor-President Guillory is going to make a few remarks.
All right, good afternoon, and thank you guys for coming by. Yesterday, President Trump extended federal guidelines for social distancing until April 30th. This means that we have a full month in which we must continue our efforts at flattening the curve in the spread of COVID-19. The situation has become dire in some of our nation's population centers. Our nation's leading public health experts who are working closely with the president warn that contagion hotspots could develop in communities large and small across our country. The strong need to limit the spread of the virus is demonstrated in our local parish numbers for today. We went from 50 reported cases yesterday to 82 today. That's a jump of over 60% in one day. And that's just the reported cases. We will see more cases as the notification process is completed after positive tests are received. Even counting just the cases we have officially confirmed, we have seen a more than 800% increase in the last week, from 9 cases to 82. The doctors on our public health advisory team, some of them are here today, advised me that these numbers are of our multi-symptom criteria patients only and are not a true representation of our total population. In other words, there are likely more cases than are being recorded. Additionally, our doctors have asked me to deliver a message to those people that have been screened and tested positive. If you have gone to our screening site at the Cajun Dome and have tested positive, don't go to the ER. Instead, please contact your primary medical provider. Our response to this public health emergency is not a sprint. The journey ahead is a marathon, or if we do the best job possible here locally, a 5K. If we don't, this situation could drag on indefinitely to the profound detriment to us all. Working closely with the Acadiana Planning Commission and our local mayors and parish presidents across Acadiana, I've been asked to deliver a specific message to our people today, not just the people of Lafayette Parish, but everyone in Acadiana. When you go shopping, the best rule is one buggy, one person. In this matter, we speak with one voice all across Acadiana, one buggy, one person. Otherwise, we're putting people at risk. We're receiving calls about people not practicing social distancing while shopping and going about their daily business. This is especially true at large retailers, rental centers, and home improvement businesses. I understand that we all want to use this time productively and to complete projects at home. But that newly renovated kitchen or recreational space won't bring much joy to a family if the price includes the severe illness or even death of a loved one. If you are not taking this guidance seriously, please understand that you are literally taking your own life and the lives of everyone you love into your own hands. It's not worth it if you bring this virus home and infect a parent, a grandparent, a child, or your spouse. While the virus is especially dangerous to those who are elderly and with underlying health conditions, we are seeing clearly that anyone, a healthy 17-year-old, an infant, literally anyone can be infected by this virus and be killed. No number of emergency proclamations, no number of tickets written can match the impact of our people showing good judgment and common sense and taking this situation seriously. We are Americans, and our freedoms are precious to us. But we must have life in order to enjoy the blessings of liberty and pursue happiness. If you consider yourself a patriot if you consider yourself a person of faith, if you consider yourself a person of good social conscience, this is the time to demonstrate to yourself, to your family, and to your neighbors and friends what that means. If you're invited to a crawfish ball with friends, if you're invited to a house party, if you're invited to shoot hoops or with a friend or play tennis or a round of golf, when you tell your friends no, let them know it's because you love them and that you care about their well-being. You can always call ahead, pick up and eat those crawfish at home with your family. We just need to do what we always do in times of emergency. We need to show how much we care about each other by being careful. I want everything to get back to normal as soon as possible. The only way we will be able to restore some level of normalcy to our lives is to act like we understand how serious this public health emergency is, both now and for the next 30 days. As a result, I'm extending my emergency declarations of March 15th and March 16th until such time as the governor rescinds the various statewide emergency declarations now in effect. On a positive note, I am pleased to share that our Economic Recovery Action Team is up and running. We are taking calls from local businesses, employees, and those who have lost their jobs. Jamie will share the statistics from today's calls to the 311 Center. We're also taking additional proactive measures to help those in our community who are suddenly unemployed through no fault of their own and may not yet have any form of support. Starting tomorrow at 11 a.m., we will be providing meals to our local unemployed people who need help at the Robichaux Recreation Center, which is located at 1919 Eras Landry Road. If you are in need, please come by. I know Jamie has updates on several items, so thank you for your time and attention. And also, we do have two medical doctors, Dr. Odnay and Dr. Stefanski, here with us that can answer medical questions. But before our doctors have an opportunity to answer your questions, I have time to answer a few of your questions. Any questions of me? Yes, sir.
So, in your remarks, you mentioned you were asking people, to think twice before they play tennis, before they go hit a round of golf. Why not shut those facilities down?
Now, I wish I could hear you, Christian. Can you say it again?
It's okay.
Hey, right when you start asking the question, the traffic came. That's okay.
So, you mentioned in your remarks that you're encouraging people to think twice before they play specifically a round of golf or go play tennis. I mean, why not shut those facilities down? We still have. I don't think we've taken that step. Correct me if I'm wrong. But.
Right. We're acting in accordance with the governor's executive order. His order does not specifically shut down public golf courses and public tennis areas. He has his order has shut down health facilities, but it's my understanding, and again, I work very closely with the governor's office, to the Office of Homeland Security, with his legal team, our legal team here at LCG, to make sure that we're interpreting his orders correctly, which are binding on local municipalities and parishes. And at this time, there's not a legal call to shut those facilities down. However, I will say that the facilities that we do control, our LCG golf courses, have been shut down.
But what about parks?
Parks, okay, so we have two components, parks and recreation. Our recreation centers have been closed. We're going to use one of the recreation centers tomorrow to start helping those in need that are suddenly find themselves unemployed, that cannot provide for themselves, to have a meal that will be able to help them out, and that would be the Robichaux Recreation Center. As far as the parks and the open spaces, they are still open. We encourage strongly to exercise social distancing. That 6 feet rule is a very good rule to follow, and it kind of goes back to show you, though, Claire, that the first line of defense starts with us.
Would you repeat, the Robichaux Center meals start tomorrow at what time?
11 a.m.
And
Yes, sir.
Can you explain where this idea came from to start feeding the unemployed? Can you give us some background on how you got to it?
Sure, we want to take care of our community. So there's many aspects of this virus. And as you can see, as we develop, because we meet every single day, roughly at this time, we talk about the needs of the day and the needs as we're combating this very serious virus. Number one issue is public safety. formulated a good, strong medical task force that give me advice to tell me where we need to escalate the level of preparedness. Also working with our parish presidents and mayors across Acadiana and to ensure that we're all getting as much information as we can, both on the medical side and other aspects. Another component to this very deadly illness is the economic impacts. So our economic recovery action team here in Lafayette and the Acadiana region is very strong. And again, encourage anyone that's either employer, employee, someone looking for a job here in Lafayette. We have businesses that have proactively listed their business on lafayette.org/COVID that are saying, hey, we need help, and we have a lot of employees out there that need a job. So the other component, and there's many components to this, but one other component is we have a large part of our population that suddenly find themselves unemployed through no fault of their own. They didn't ask for this. No one here asked for this virus to come affect our economy. So we as local leaders, we have a duty. We have a duty to take care of all of our people. And that is one component of it.
Let's start with the economic task force or the COVID-19 task force. Do you know where the idea came from?
To help people?
To start feeding people at 11 a.m. at the
Well, it seems like it's lunchtime. Most people eat between 11 a.m. and 1 p.m.
Did it come from one of the task forces? Did it come up in a meeting?
I'm not sure I understand your question.
Was it discussed at the COVID-19 task force or this new economic task force?
Oh, it's locally here at my administration. We huddle up every day throughout the day. But again, I understand the call of the question. You know, basically, what spurred the time? 11 a.m. to 1 p.m. seems to work. I want everybody to know that we need to be flexible, that things may change. If we see a need where we can help people at additional hours of the day as it relates to feeding families who suddenly find themselves unemployed or in need due to no fault of their own, that we will flex. Just like we were prepared in the medical situation, medical side, we had 5 locations established, and if the Cajun Dome site would have been, if it had been too hectic for that particular screening site, we'd have flexed to one of our other municipalities. Same thing with our economic recovery action team. You know, we start here locally, Lafayette. We spread out throughout the Acadiana region. I'm so thankful for my fellow parish presidents to join into this fight and this effort as we help our people. Same thing with feeding families that need food. It's important. We're in this together. Yes, sir.
Yeah, so it's my understanding there's still a pressing need to figure out how to shelter some of the area's homeless, right? Arch, for instance, I think has asked for something like 50 grand, 60 grand, I don't remember what the exact number was, to try and get emergency shelter for people where they're going to pay for hotel room. Are you looking at the possibility of diverting resources, like spending money, LCG money, to do that?
We have no plans to spend LCG money at this time. We're open to any suggestions. We're working heavily with Catholic Charities. Again, I want to thank my parish council for coming to bat for our people here in Lafayette Parish that did allocate certain funds to combat the COVID-19 spread, and that's not limited outside of our homeless population. And you know, you raise a very good concern, Christian, because a lot of times our homeless members of our population are in very small contained groups, and it's easy to spread. Now I know Dr. Stefanski can talk about the Chico State Park mission, where any homeless individual in the respective parishes of Region 4, right, Doctor? Region 4 that have tested positive for COVID-19 will be shipped to the Chico State Park facility to wait 15 plus days to make sure that they're treated.
Some of those folks are starting to come back. I don't have numbers on it. And I guess my concern is, like, do we have a local government plan to do something about it? It sounds like no is the answer right now.
Well, I just told you the plan. So we're going to locate the homeless individuals in our community. We're going to get them screened if they have the need, if they provide themselves with symptoms to a healthcare provider. Once they test positive, they will be shipped to the Chico State Park for their treatment regimen. Once their treatment regimen is complete, we will coordinate with local and state officials to go to the next step. And it's my understanding that each of the homeless individuals would be shipped back to their respective parish. Any other questions?
So where's the money for the lunches coming for? Is that an LCG or is that
Great question, Claire. Great question. And as of right now, the funds are coming from the private sector, and tomorrow I will be able to have some more information as far as who is leading the charge and leading the way there, because we're able to, and you know, just another beautiful attribute that you're highlighting from the great people of Louisiana from Lafayette Parish and the Acadiana region. We don't need the government for everything. The government has very strict roles, but most of the most beautiful examples of life here in Acadiana and Louisiana comes from our people. So this has been an effort that is led by the private sector. Again, tomorrow I'll have some more news once I can get all the facts together to present to you, but I'm very pleased to say that we will be able to provide this mission to help those in need with very minimal taxpayer dollars. Any other questions?
Yeah, how have you guys?
Any questions on this side? I'm just picking with you, Christian. Go ahead.
How have you guys coordinated that with, say, like Second Harvest and other groups that are trying to actually get a handle on the feeding situation? I mean, it sounds like they've really had to wrangle with how to deal with food supplies, how to deal with warehousing in a situation where, there's always concern about spreading the virus. Have you worked with area nonprofits on this specifically? What are you guys doing to make sure that this is a safe distribution point?
Yeah, we definitely encourage all the efforts of all our nonprofit organizations. I know they have a lot of good intentions, and we continue to encourage our people, whether you're a big organization like Second Harvest, as you mentioned, Christian, or small groups, continue to help our community, and we work with anybody. Any other questions of me? Again, we do have 2 medical doctors from our task force that I encourage you to ask questions to. Dr. Stefanski is the leader of our medical task force, and we're very blessed also to have Dr. Odney with us here. He is an ER physician, so but he's also volunteered a lot of his time here at the screening site at the Cajun Dome. So I'm just so thankful to all of our first responders. We have our chief of police, our chief of fire here in audience. Our National Guard members have been fantastic. Our deputy marshals. Again, I say this all the time. If you want to see the beauty of Acadiana, you come visit, witness situations like at the Cajun Dome and across our parish. There are many screening sites that are popping up from Iberia to Erath, just across our wonderful state and country. Any other questions of me? All right. So again, I appreciate your time, appreciate what you do. I ask for God's blessing on each of you in our wonderful parish and country. Thank you. Dr. Stefanski?
So I don't know if you have any questions for me or Dr. Odney, who's an emergency department physician, so right in the middle of things and can absolutely speak to the importance. As the Mayor-president said so well, government can only do so much. Healthcare can only do so much. We really need to implore the residents of Acadiana to take those precautions. These social distancing guidelines are based on science, on evidence, based on what's been proven in past pandemics, and actually with this pandemic has proven to be effective. So we ask that people take that seriously. Parents, talk to your children, your teenagers. They should not be going to parties. They shouldn't be having pool parties. This is a time for people to keep their children home, for parents to act responsibly, for adults to act responsibly, and not congregate in big groups, and then further encourage the spread of this virus in our community, and also further your risk of being exposed. So, he said it so very well, and we just ask and implore that people take those words very seriously. Otherwise, who knows how long we'll be in this situation. We need to do follow these social distancing guidelines well. We need to be really, just really strictly enforce these guidelines from a personal perspective if we're going to hope to see an end to this in the near future in our community. So do you have any questions for me?
I know today the governor said, under any feasible scenario, we're going to exceed the capacity for the state of Louisiana. Can you talk about, there's some things people can change at this point, but there are some eventualities that are going to happen, and what the difference will be.
Sure. So we see in our state, New Orleans is probably a couple of weeks ahead of us in what they're dealing with. So we hope that these social distancing practices will impact our region in a positive way, so that we won't see the impact that they're seeing in New Orleans. But again, Dr. Odney can probably speak very well to some of his counterparts that are there, what they're dealing with. But we met this morning with the Mayor-president, with the 2 hospital systems, with physicians that are again working in those hospitals and on the front lines. And our hospitals are feeling a strain. We're seeing very sick patients. Our hospitals are near capacity. We still have capacity in this region, but we can see that in a couple of weeks, if things continue to, if the numbers continue to grow and the hospital admissions continue to increase, we potentially could be in a situation where, again, as we've been saying, our healthcare system could be severely impacted. So we've got plans. We're working together to prepare for that. We've got an incredible healthcare community here in Acadiana who have been working behind the scenes to prepare and stand up should we get to that point. But just know, again, we implore people to try to help us to avoid getting to the point where we're really having to implement some practices that we really never expected to.
Can you give us an idea how many people are hospitalized across the region? And in the tens, in the hundreds?
Oh, I can tell you, so this is where it's kind of a mixed bag. So we have many people who are hospitalized who are still waiting on test results. So the number is very hard because you have those that are positive and are hospitalized, and then you have those we call persons under investigation for whom have been tested. But I would say in our region, we have well over 100 people who are hospitalized who are either positive or we suspect might have this virus, and several people in the intensive care units very, very sick in this region.
To your point about the impact, I've seen some emails suggesting that authorities or officials were looking at like an early April potential timeline for capacity in our region and other regions in the state. Is there any legitimacy to that, or what are we looking at?
So there's some models, some projections that are being evaluated at the state level, and so I'm hopeful that in the next couple of days those will be released, and we'll all see the efforts. There's been a lot of work towards trying to figure out what that where you'll start to see the peak, and then where again we hopefully start to see the decrease in cases. But at this point, I don't have those models to share. But we do know early April is the best evidence that we have in areas like New Orleans, where they may start to reach capacity and have to expand to alternate facilities.
Following up on that, is there any indication that we are sort of pulling that curve flatter at this point?
No, we don't have enough information just yet to be able to say that. But we do know we're seeing an increase, and since Friday, our cases in Acadiana have doubled. So as we expect, we're testing more people. We expect to see that increase. But I can tell you from looking at the cases and evaluating what we've seen, the test results are now coming back quicker. So people are being exposed now and sick. So that tells you that the virus is actively circulating in this community. So in order to reduce your risk of exposure, stay home and limit your exposures to other people.
I've seen some figures. I guess the nomenclature I saw was pending cases. You described, I forgot the term.
Persons under investigation, same thing.
Same
Yes.
thing. So have you seen the number of pending cases continuing to climb, or can you see
Yes,
to the rate?
that continues to climb because more and more individuals are showing up at the hospitals, coming to these testing sites and are tested. So we continue to see the number of tests outstanding grow.
So I guess my question is like, are you seeing the rate pick up of the number of pending cases climbing, if that makes sense?
So we talked about that this morning. We're trying. There's just so many outstanding cases that it's difficult to say what our positivity rate is, and it's also a little bit of a false number since we're not testing everyone in the community. We're not even testing everyone who's symptomatic, because of the limitation where these wonderful physicians, nurses, National Guardsmen who are at the Cajun Dome and at these other testing sites are only testing the highest risk individuals. So we really don't have a true picture yet in this region.
What is the best indicator you have for projecting a peak? When you guys are looking at your data, like what can you look at and say, all right, well that's...
So, they don't know at the federal level, so we certainly don't know yet when we can expect to see a peak. We only know the projections. We can look at when we might reach hospital capacity, and that's the models that we're all looking at, and hopefully we'll see some of that information for our region in the next couple of days. But as far as the peak, no one knows.
I apologize. I'm sorry. The question is more, what would you be looking at to see? I mean, like, what number would you track, not what does that number got to be?
So when you start to see when you actually start to see the decrease, so the peak is going to be the peak. What we'll be looking for is when the percent of positive test results starts to slow down. So that's what we're looking for, and that's when we'll know we're on the downward curve.
Just statewide or like?
Statewide. We're looking definitely at regional statistics as well, but yes, statewide is I think where you'll see the cumulative reports.
I know you said here we aren't able to test everyone who is symptomatic. Are you seeing anything that makes you hopeful that at some point we'll get there?
Yes. So, I think every time I'm here, I say the same thing, but there is testing, supplies, and availability is increasing. It's just been slower than anybody would like, of course, but testing, supplies, and availability is increasing. And, there's actually some tests now that'll be much quicker, a quicker turnaround, almost like a rapid flu test. So hopefully in the next, we don't know, several weeks, a month, hopefully there'll be even a quicker testing available.
You're referring to like the 15-minute test that Abbott is producing?
Yes, it's not available here yet. Yes.
We have, it's been our understanding that 2 hospitals in the area that are ICU diversion. Can you confirm that? Can you explain to us what that means?
So, I don't have any specific information to share about those particular circumstances, but I can just tell you that we do still have ICU capability and capacity in this region. So we track ICU beds region-wide daily, and so we do still have ICU capacity. But again, we're seeing an increase in the number of cases admitted to the ICU, and it's not just COVID or individuals, PUIs for whom we suspect may be infected with this virus. It's also people who have all these other health, all these other issues, right, that where you admitted to an ICU. So heart attacks, strokes. So, back to personal responsibility, we need our healthcare system to be there and functioning at its greatest capacity to be able to take care of all individuals in this region.
You're not aware of hospitals diverting ICU patients elsewhere?
No. And I don't want to, monopolize the microphone. Dr. O'Dney's, again, in the middle of things. I don't know if y'all have got any questions for him.
I can direct the same question to him. I don't know if you would have.
Yes.
I don't know what hospital you work for. I apologize.
So, Michael O'Dney, I work for Our Lady of Lourdes in the emergency department. So what I can tell you about ICU diversions in the area is that happens on a daily basis across the state, even if we're not in a pandemic. So an ICU may be on diversion, but that would not be unusual on a regular day. So I can tell you that our hospital is not currently on ICU diversion or have been any time in the not so distant past. So
even if you were, it wouldn't necessarily indicate a critical situation.
No, because in Region 4, a large portion of the hospitals are smaller hospitals, and they exceed capability quickly, and they typically will bring them to the larger facilities so that we can manage them better and have the resources to manage those people.
Can you give us an idea how things in general are going at your hospital? What are you seeing? How are your doctors and nurses and other personnel holding up?
Our staff is amazing, from the nurses to the hospital staff to the staff that are cleaning the rooms. Takes a lot of effort to clean rooms after a suspected COVID-19 patient is in there. But everyone is really put their best foot forward for Acadiana in the community right now, and we're doing okay. We're doing well.
Is there anything the public can do to help you guys?
Yes, follow Dr. Stefanski and the mayor both just spent a good bit of time just now explaining what the public can do. Stay home. Take heed to the warning. Watch these news conferences. This is a fluid situation, and those are the best things that the public can do. It's hard to do. We're all away from loved ones that we'd like to be with and enjoy. It's hard. My wife and kids have been gone for 10 days now, and but it's a fact of life in this time. So everybody do that, participate, and that's the best thing that you can do for Acadiana and the country.
Has your hospital made any changes in layout to address capacity at this point yet?
Absolutely. We're doing that's been in the works since all of this started. The preparation from Dr. Stefanski and her team has been amazing. She is like I tend to say, she lives in this space. So she has her best foot forward again, and she has a team around her that have made preparations not only for the hospitals, and all the hospitals are participating in that, but for exceeding the hospital's capabilities in surge should that occur. We have those plans in the works as well. So,
could you describe what you guys are seeing as far as cases with they're presented to the hospital and they're hospitalized? I mean, what's it been like?
It's so, you know, what the mayor said, when you test positive, you should stay home, call your doctor. We treat people on a clinical basis. If on a regular day you would go to the emergency department because you cannot breathe and you tested positive, we want you to come to the emergency department, because on a regular day, if you could not breathe well, you would come in, right? So that's what we want. But on a regular day, if you had the flu and you just felt body aches and maybe could take some Tylenol and drink some fluids, we want you to do that as well. We don't want you, just because you had a positive test, to come in. So we're seeing a lot of obvious screenings for COVID in the hospital, and we're seeing our routine cases that we see on a regular basis as well.
A lot of good information. In case you didn't know, today is National Doctor Appreciation Day, so quick hand for our docs here. Thanks for all you do.
Please mention that they're volunteering at the Cajun Dome.
Oh yeah, Dr. O'Day has been up Cajun Dome since day one, and along with Dr. Claymore, Dr. Claymore, so yeah, Dr. Hordish. So Cordish. I said that wrong, Cordish. So we thank them so much for all the hard work they've done. So thank you. All right, let's get to the numbers, and a reminder that this will be translated for our Spanish-speaking community and will be posted to our Facebook page later today. Thank you to Telemundo. LCG LIDA call center. Between 10 and 2 o'clock today, LIDA staff answered 156 total calls, and it ran very smoothly. Average wait time to reach a staff member was only about 14 seconds. 10 LIDA employees are working those phone lines, and out of those calls, 50 were from business owners, 53 from employees, 16 were other, 26 were, they're going to need to make follow-up calls on those. And in our drive-through over here at LCG, we handed out about 130 pieces of information. About 98% of those that came through wanted SBA information. So again, good source. We have it here. The drive-through here at 705 West University and the call center will open again tomorrow from 10 a.m. to 2 p.m. If you're calling in, dial 311, then press the option for number 2. Cajun Dome screening site, 68 people went to the site today, 68 people. 18 were screened out, 50 people were tested, and that site will reopen again tomorrow morning from 8:30 until 10:30. I know some of the news outlets have put 8 to 10:30. I just want to make it clear that that's 8:30 to 10:30. 311 update yesterday, medical staff answered 297 calls. 22 were sent to the Cajun Dome, 18 were non-medical related, 13 were general COVID-19 questions, 12 people were sent to their primary care providers, 6 people were sent to the emergency room, 13 were sent to urgent care, and 27 people were instructed to self-isolate at home. And I know over the last few days, if you add all those numbers up, it doesn't equal the total number of calls, but you have to consider hang-ups and redials and stuff like that. So that's why those numbers often don't match the total. As of today, like the mayor-president said earlier, in Lafayette Parish, we have 1 person who has passed away and 82 people who've tested positive for COVID-19, 32 more since yesterday. And exactly 1 week ago, on the 23rd, Lafayette Parish had 9 cases. Here we are 1 week later with 82. That's an 811% increase in 1 week. That's 9 times more cases since last Monday. So please don't let your guard down. We're going to continue to say this. I'm the 4th person that has stood up here today and said, ask people to stay home. We want the media to ask people to stay home. Use every avenue you have, social media, broadcast, and please spread the word. Now, Claire, you posted something on social media yesterday, and I hope you don't mind, but I'd like to share some of it, some wise words about social distancing. This is what social distancing and staying home means. Grocery shop when necessary, and do it alone. You know, 1 person, 1 buggy. The whole household doesn't have to go. And you should not take your children with you. Please leave your children at home. No pool parties, crawfish balls, barbecues with neighbors, friends, and family who don't live with you. Don't visit family or friends if it's not necessary. Use FaceTime and Skype if you want to share that smile. I FaceTimed with my dad yesterday. He just got an iPhone not long ago, and he was very surprised you could push 1 button and see someone else. So he calls me often now on FaceTime. Don't take your children to visit grandparents or great-grandparents. Do not visit your elderly parents. If they need supplies, leave them at their door, but don't go in. Don't shop for shoes or clothes and the likes. Just because some stores are open, this doesn't mean you have to be there. Don't let your children play on playground equipment at the park. Yes, I know, some of the parks are still open. There are some parks where the playground equipment has been roped off. But if it hasn't been, that doesn't mean you should let your children play on it. It's a breeding ground for stuff. And you're not going to be able to sanitize the whole thing in between playground visits. So please, don't let your children play on playground equipment. Don't play basketball or other contact sports. You know, Frisbee golf can wait. You don't have to play it right now. Staying home is not just about your safety. You may be a carrier of coronavirus and can infect your parents, grandparents, friends, neighbors, and strangers. Staying at your home is the only way to stop the spread. Mental health. 211 and Family Tree are seeing an uptick in the number of people reaching out for counseling to deal with anxiety and uncertainty as this pandemic continues. Reaching out for mental health services and dealing with anxiety is nothing to be ashamed of, and it is encouraged for folks to reach out. Family Tree offers telecounseling sessions. They accept Medicaid plans. For those who don't have Medicaid, a 30-minute session is $40, an hour is $65. For services, go to acadianafamilytree.org or give them a call at 337-981-2180. Again, that's acadianafamilytree.org, or you can call 337-981-2180. Yes, 337-981-2180. Also encourage you to contact 211 and 232 HELP. They also have some mental health resources as well that they can put you in touch with. A reminder, 211 is the number to call for general questions about COVID-19. 311 is the number to call to be pre-screened. If medical staff determines someone needs to be screened, they are sent to the Cajun Dome. The Lafayette Parish School System asks us to remind all public school families in the parish that the current grab-and-go meal service is transitioning to a home delivery service. In order for students to receive meals delivered directly to their home, they must apply by the deadline of Wednesday, April 1st. That is the day after tomorrow. This Wednesday is the deadline. It is an online application that can be found on the LPSS website. All students receiving free or reduced lunch qualify for the program, and all students at 36 of the 47 schools in the district qualify for this program, but must apply to be accepted. A list of those individual schools can also be found on the LPSS website. Again, the deadline to file for the meal delivery is Wednesday, April 1st, this Wednesday. Parents who need assistance with the application or have questions should call the LPSS Meal Service Hotline at 337-521-7370. 337-521-7370 for further information. With that, we'd like to let you know that we have reached out to the surrounding parishes and those mayors and parish presidents to let them know that if they do have information to put out, they can start directing it to us, and we'll start putting that out for them at our daily press briefing, since all parishes logistically can't have those. So, any further questions? Andrew.
We haven't age yet on the one person in Lafayette Parish who died. LDH didn't report it.
Right. At one point, they were posting the ages on the site. They stopped doing that. And again, we got the information from the same place.
Last Friday, the mayor-president said, he announced the fatality here that we just mentioned, and then said that y'all expected to get some announcements soon. And my understanding in walking away was that there were some people who had passed away that we knew of. It wasn't just sort of a general, here's what's coming, but the number hasn't changed in Lafayette.
Man, Dr. Stefanski just walked off too. Christian, again, that was the information we were given from Dr. Stefanski and her team. I would reach out to her. I can't say with certainty that we have a definitive number on that. All I know is that she said expect more in the coming days. So if it hasn't happened, it will. And again, we all know the fault in some of these numbers that are coming out, especially testing results. they are somewhat misleading, as Dr. Stefanski mentioned earlier. So again, until they sort some of that stuff out, it's going to be hard to get a clear picture.
When we see a dip in the number of positive cases reported per day over the weekends, is that just a function of like operations then? That's not like...
It's a function of those labs get those tests from all over the country. When they get to ours and ship ours out, it's all dependent on them. I mean, if I could say, hey, why don't you put Louisiana at the front of the line, that would be great. But ideally, again, we've noticed that some labs, the results are a much quicker turnaround, but we know that some of the other labs are experiencing some backups, but they are working to mitigate that at this point. But no, I would not look at the numbers from the weekend and use that as an indicator that we're seeing a reduction, because obviously we had our largest one-day jump today. So
Do you have names of folks that are on the economic task force?
I don't have the list of names currently. I can try to get you that, but I know that it's in conjunction with LIDA, and they've taken the lead on that thing, right? And LIDA in itself is a conglomeration of different business leaders. So I don't know if conglomeration was a good word, but thank you. Bunch of scholars here. Any other questions?
I do have one question about the Robichaux Center feeding, right? It strikes me that there are other, like, you guys have deferred to the nonprofit community on other issues. There seems to be an effort, proactive effort, to try and make sure that people get fed. Is there any concern that you might be duplicating efforts here? This might actually cause some complications?
I think tomorrow, when we are able to put out a little more information on this, there will be some understanding as to why this is happening. But for right now, we are limited in what we can put out about that. But there are some entities in the community that have stepped up to do this, that are in the private sector, that are kind of doing this on their own. So we are just facilitating that, if it makes sense.
It does. I guess, and I don't know if this is LCG's role per se, right? So I don't want to put you in that position. But, I mean, why not sort of convert them over to the existing sort of channels that are trying to get set up? I mean, like, if folks want to do this, we have Second Harvest, that's kind of what they do.
Again, I encourage you to be a little patient. We will be able to release more of that information tomorrow, and it should make things a little clearer when it comes to that. As far as working to feed people and help out, again, we do support our nonprofit communities in that. We highly encourage them to continue those efforts, and we are by no means trying to minimize or take away from those efforts that they're trying to do. It's just that this situation is a little bit different. All right, no other questions. I wish I could tell you that our press briefing would be at the same time tomorrow. I am just still not sure what the governor's schedule is, so we'll be working around that, but we're going to still continue to try to bring them around the same time. So, all right, and again, our Spanish version will be posted in just a bit. So